Hello, my name is Alicia Bexton, and today we're going to be talking about nurse burnout and the effects of working extended shifts. So let's get started. So next we have the PICO problem. P, also known as population, is the nurses within the acute care setting. I, also known as intervention, is to provide the Maslach inventory survey to nursing leaders to help them assess burnout in their staff members. C, also known as comparison, is to determine if working 8-hour shifts causes less burnout than working 12-hour shifts. And O, the outcome. Are the symptoms with burnout improved by working the shorter shifts? And my research question is, are nurses who work 12-hour shifts at a higher risk for nurse burnout than nurses who work 8-hour shifts? So the background of the problem: traditionally hospital nursing was organized around a 3-shift pattern, often consisting of an 8-hour shift commencing around 7 a.m., followed by an 8-hour shift at 1:30 p.m. to 9:30 p.m. and a long night shift from 9 p.m. to 7 a.m. This pattern incorporated periods where shifts overlapped to facilitate handovers. After that, they went from the 7A to 3P, 3P to 11P, and then 11P to 7A. Nurses who work 10-hour or longer up 2.5 times more likely than nurses working shorter shifts to experience burnout and job dissatisfaction. 8-hour shifts for hospital nurses are becoming a thing of the past. Nurses increasingly work 12-hour shifts. The schedule gives the nurses a 3-day work week, providing work-life balance and flexibility. However, actual shift lengths are often unpredictable as fluctuations in patient needs and unanticipated staffing changes occur. As a result in this, nurses often must put in unplanned overtime beyond the scheduled shift, which results in them working longer than the 12 hours to begin with. So when long shifts are combined with overtime, shifts that rotate between day and night, and consecutive shifts places nurses at risk for fatigue and burnout. Also, 12-hour shifts have an impact on nurses' health and well-being, such as cognitive anxiety, musculoskeletal disorders, sleep disturbance, and role stress. Studies show that nurses experience more fatigue working 12-hour shifts in comparison to 8-hour shifts. And something that Bayada Home Health had was nurse burnout is correlated with increased risk of infection to patients. If they're really tired, they may not take on the interventions they're supposed to, as far as like hand washing or normal hand hygiene. Lower patient satisfaction, because if they're tired, they're probably not giving it their all. Maybe they're not in a good mood. If they're not positive, then the patient's not gonna be positive about their care either. So, stakeholders and buy-in. The stakeholders are high in nurses who work in the acute care setting or any nursing facility requiring 12-hour shifts. The buy-in: nursing and human resource leaders within the facilities requiring 12-hour shifts and nurses working those 12-hour shifts. Nursing leaders are to implement interventions to avoid nurse burnout, and nursing having the ability to set boundaries for themselves. So, the nurse leaders have to provide the implementations, but the nurses themselves have to follow those too and hold themselves accountable. So this is a really good resource for nursing leaders, just kind of about how they can implement those steps that they need to take to improve nurse burnout. So, some barriers to implementation. Nurses who prefer a 3-day work week. Nursing leaders who feel that filling a 4-hour hole would be less difficult than filling an 8-hour hole. And then families of nurses who enjoy having their loved ones off 4 days. That's huge too. It gives them the availability to make doctor's appointments so where they don't have to take off of work, where they can stay home with a sick kiddo, and don't have to call in if it falls on that day, that kind of thing. So if you're working 5 days a week, it's going to be much harder to make it to your doctor's appointments and things like that. So my steps to implementation is to develop a PowerPoint presentation on interventions that nursing leaders can use to prevent nurse burnout with their staff. Also, to provide the Maslach burnout inventory for nursing leaders to provide for their staff members to evaluate burnout to get to the root of the problem. The Maslach inventory, it really helps them correlate the reason for the burnout. Is it because they're mentally and physically tired? Is it because they don't find satisfaction in their job? Is it because they're emotionally giving so much that they have nothing to give when they get home? It really tallies out what is causing their burnout, and that really helps leaders to understand what is causing the problem. Can we fix it? If we can't fix it, what can we do to make it better? And then the last thing is to present my PowerPoint presentation on the effects that working extended shifts has on nurse burnout. So for my evaluation, I found the Maslow inventory scale. And with this, it helps nursing leaders to provide staff with this inventory in order to evaluate their level of burnout. So this really will help get to the root of the problem. So the Maslow burnout inventory looks a little bit like this. It's basically broken into 3 sections. So section A is going to ask questions like, do you feel emotionally drained after your day of work? Do you feel physically drained? Section B is going to ask about whether or not you want to go to work the next day. Are you emotionally exhausted to where you just can't even imagine going back to work? And then section C is going to ask questions like, do you have energy? Do you feel like your work is, meaningful, worthwhile? Do you feel like you are emotionally unstable due to your work? That kind of thing. So with this, it really helps leaders get down to the problem and figure out, okay, what is causing the burnout with my staff? Is it just because they're overworked and emotionally tired, or is it because they're giving too much of themselves to their patients and they need to set, personal boundaries in between work-life balance and work? So it's a really good tool for that reason. So that brings me to my related items page. So the first part, you just see my screenshot of my actual presentation to the nursing leaders, and then a various amount of videos here. So the first video that you see to the right there is one of the physicians with the Mayo Clinic, and she talks about the direct supervisors and how they play a role in nurse burnout, because there's a lot of issues with direct supervisors not wanting to listen to their staff and understand that they can really help. And sometimes when people don't feel like they can go to their manager, it makes the situation escalate quicker because they don't feel like they have anyone they can talk to, or they have talked to their supervisor but it just doesn't go anywhere. So she talks about that. And then the next video at the top right is from the Institute of Healthcare Improvement, and it's just about nursing leaders getting down to the root of the problem, asking the difficult questions like why, staff is burnt out, what is the problem? And then down to the bottom left corner is Mama Nurse. She's a blogger and she teaches ways for nurses to prevent burnout themselves, to hold themselves accountable. The work-life balance, being able to say no, making sure you get enough rest, that you eat a good diet, that you get some exercise, those types of things. And then my inventory, the Maslow inventory that we just talked about, is on here as well. These are all the resources that I used to present to the nursing leaders. And then last but not least, these are my references that I used to compile my research. Thank you so much for taking the time to listen to what I have to say. I hope that this gives you a clear description of what I went through while I compiled my research. Have a wonderful day.